I'm Lynn Faulds Wood, and I want to thank you for watching this. Now, you're probably watching because your doctor has recommended that you have an internal investigation called a colonoscopy. First, let me reassure you, many thousands of people a year have colonoscopies, and most of them don't have cancer. I'm about to have my colonoscopy, and you'll be able to see exactly what's involved.
I'd like to talk to you about the thousands of people who've lost money to your husband's companies.
You might remember me from the BBC's Watchdog programme. It was while I was presenting that programme, I was diagnosed out of the blue with advanced bowel cancer.
They have just... Don't kick me.
You trespassing.
You're squashing me.
It was just a few weeks after this photograph was taken that I got the shock diagnosis. My son was just 3 years old. It was a devastating time for us. Luckily I survived, and I've been campaigning to raise awareness of bowel cancer ever since. Every 5 years I have colonoscopies to make sure the cancer hasn't come back. I'm having my colonoscopy here at St George's in South London, a centre of excellence for the NHS bowel cancer screening programme and my local big hospital. Units like this handle thousands of patients every year. Some are here because they have symptoms, some because of family history, and some for the bowel cancer screening programme. But many people are not really sure what their bowels are and what they do. We use the word bowel when we want to talk about this important part of our body's food processing system. There's the small bowel or intestine, and then the large bowel or colon, which is where the word colonoscopy comes from. And down at your bottom, there's the rectum. Most cancers are in the lower colon or rectum. Bowel cancer is the second commonest cancer. Colonoscopy is a really effective way of finding it. By looking inside our bodies for small wart-like growths, they're called polyps, which can turn to cancer. And colonoscopy works best if we help it. Now, it's really important that you clean out your insides so they get a clear view of the walls of your gut. And to do that, all the hospitals will send you a really helpful fact sheet with things like what you can eat the day before, breakfast of white toast, tea, coffee, no milk, that sort of thing, what clear liquids you can drink. They'll also send you laxatives, and you take some the night before and some on the day. And it's really important that you take it all. I'm about to have mine. Doesn't exactly taste pleasant, but we've got to do it. On the day of your colonoscopy, you won't be able to eat anything. I was already really hungry, but I got here early so I could have a quick chat with the specialist, Roger Lester. So, what is a colonoscope and what does it do?
Okay, a colonoscope is, as the name suggests, an instrument for looking into the bowel or the colon. It's about the same, slightly smaller diameter than my finger, very long, because the colon is about 1 metre long, and we have 1.5 metres, which gives us the length to go around the whole colon.
And bendy.
It's bendy to go around the bends, and we can manipulate the tip of the instrument with these two wheels. And ultimately, we aim to go around a colon with that kind of length.
People think this is painful.
It shouldn't be painful, as long as the colonoscopist is well trained. And effectively, you are moving somebody's colon. It feels uncomfortable. It should not be painful. It's slightly uncomfortable because your bowel is basically rotated by using this instrument, but it shouldn't be painful.
Let's hope so.
Lynn Faulds Wood, please.
That's me. Thank you very much.
Hello, my name's Beth and I'm one of the nurses. I'm going to be admitting you today.
Thank you very much.
So you just want to follow me down here. We're going to go to room number 1.
I'm here for a checkup because I've already had bowel cancer. You might be having your colonoscopy because of the NHS screening programme or because you've been referred by your GP.
And then we'll get you changed and Mr. Lester will come and have a chat with you. So
Lovely.
come on in here.
Thank you very much.
And just take a seat for me.
Thank you.
Thank you. Okay. Probably going to give you a little bit of sedation today.
I'd like some.
I was going to say, most people do. In order to give you that, we're going to need to pop a needle either into your hand or your arm, and we'll probably do this in the procedure room today. Are you all right with needles?
Very happy.
Fine. So if I
The nurse will ask you if you have any medical problems which might affect the procedure, and if you're on any medication. She'll also want to know what you've eaten or drunk within the last 24 hours.
And last time you had something to drink?
About 3 hours ago.
Okay. So that would have been about lunchtime, 12-ish. Was it water?
Water, just water. I've only had
Lovely.
water this morning.
Fine. But what I'm going to do now is I'm going to ask you to get changed into one of our lovely hospital gowns. I'm sure you've seen one of these before, quite often. So we've got a bag in there for all your belongings, and a pair of shorts just to keep you nice and protected.
Lovely.
Okay. So when you're ready, I'll come back and check your blood pressure.
Lovely.
All right. Thank you very much.
Thanks very much. I don't think you're going to be watching this.